Join us, the Humanitarian Heartbeat Podcast, on a journey where we delve into the heart of the matters that truly make a difference. Our mission is to create a platform where we can openly discuss topics that often go unnoticed or unexplored. We aim to shed light on these crucial issues and have meaningful conversations. We invite you to tune into our podcast, where we will explore the depths of these subjects and let our hearts guide the conversation. Together, we can create a space where everyone's voice is heard and where we can collectively work towards a better future. Welcome, everyone, to the Humanitarian Heartbeat Podcast. I am your host, Nia Imani, and I have the pleasure of interviewing my doctor. Yes, I said my. She has millions of patients, but my doctor, Dr. Kimberly Rogers. Thank you for joining us.
Thank you for inviting me to your wonderful podcast. I couldn't be more pleased. I know you're very busy, you're doing big things, and it's always nice to collaborate with you. So thank you.
Thank you. Oh my gosh. Well, they're going to learn why you're my doctor. They're going to learn why you're after this, they're going to be like, oh, can I be a patient? No, because you need to see me. No.
Only in the state of Delaware, Pennsylvania, unfortunately.
Well, you're going to have a lot more. Listen to this. My doctor is a triple board certified internal medicine. She's triple. Let's run this back. Dr. Kimberly Rogers is a triple board certified in internal medicine, lifestyle medicine, and obesity medicine physician, and owner of RestoreMD Medical and Wellness in Wilmington, Delaware. She is most passionate about empowering her patients like myself to achieve optimal health and wellness, and enjoys fostering a collaborative relationship with her patients. Employing a whole person approach to care, Dr. Rogers practices with a focus on nutrition, exercise, and other lifestyle factors as an adjunct to traditional treatment modalities. My girl was born in Antigua.
Anguilla.
Oh, Lord. Let's run this back. My girl was born in Anguilla.
It's okay.
She moved to the United States in 2003, where she obtained a Bachelor of Science degree in Neurophysiology at the University of Maryland, followed by her medical degree at Sidney Kimmel Medical College in Philadelphia. She completed her internal residency in 2014 at Temple University Hospital and was awarded Most Outstanding Third-Year Resident in Outpatient Care. She began her primary care journey in Richmond, Virginia in 2017. She received a Best Bedside Manner Award by a local health magazine, and that has not changed. In 2018, she returned to Philadelphia, where she continued to practice, finally relocating to Delaware in 2020 with her family. In January 2023, she opened up her own practice, RestoreMD, thank God, where she practices primary care and obesity medicine with a lifestyle medicine focus. Her experience treating a medically complex patient population highlighted the importance of a holistic approach in addressing the root cause of illness. This inspired her to pursue additional training and obtained by the American Board of Lifestyle Medicine in 2019 and American Board of Obesity Medicine in 2023. She is a member of the American College of Physicians and American College of Lifestyle Medicine. You can follow her on Instagram, Dr. Kim Lifestyle MD. She continues to spread the message of health and wellness to a worldwide audience. Yeah, you can't have her.
Thank you for the wonderful intro, Dr. Nia.
My first question is, what made you want to be a doctor?
I think I was one of those kids growing up who always wanted to be a doctor or a lawyer or something like that. And I think some of it, to be honest, was, now that I look back, when you grow up and you're the quote unquote smart kid, oh, you're going to be this, you're going to be that. But I think that at the end of the day, being a doctor did make a lot of sense to me because it combined a lot of things like, yes, being able to take care of people, not having to, sit behind a desk all day. Like I was never interested in crunching numbers behind a desk. I wanted to do something, I think, that I just thought was a little bit more meaningful. And science and the human body, all of those things always appealed to me. So it wasn't like I just knew out of the womb that I wanted to be a doctor. I kind of went back and forth between a lot of different things, but by, the end of high school, I kind of figured this was one of the ways to go. And I think my mom also, she always thought that that would be a good path for me. And she wanted to be a nurse back in her day, but she's always said she couldn't stand the sight of blood. So one day I kind of looked back, I was like, Mom, I think you were the reason why I became a doctor with your like gentle nudges. But I don't regret it because, at this point I don't see myself being successful doing anything else. And it's really one of those things that I feel at the end of the day, it was a calling. And so I'm happy that I got that gentle nudge, not so gentle nudge from my mom.
I'm glad you answered that calling. How does she feel now that you are a doctor? Does that give her great joy,
Yeah, yeah, of course. I mean, I'm the first doctor on both sides of my family, so that's why part of the reason why I kept my maiden name, just because there's, I'm the first Dr. Rogers. So it's a nice feeling, and it's a pleasure every day to do what I do for sure, especially now that I own my own practice.
Yeah, what is that like owning your own practice, and what made you want to own your own practice?
So being a doctor is great, but it's challenging, and you know you can get into that whole conversation about part of the reason why many doctors nowadays don't want to continue doing medicine. I mean, this is like a whole separate topic, but the general public may not be aware of how challenging the healthcare industry is, with the being the a capitalistic type of industry is really ruining it. And I think there are so many people that went into medicine because it's this like noble calling, and then when they actually go and practice, you realize that now you're dealing with a lot of things that you didn't train to do. You're dealing with insurance nonsense, health administration nonsense. You're dealing with so many like things that are getting in between of your ability to take care of your patient. There's a lot of demoralization that's happening in the world of medicine. So when I got out of residency and, I was practicing, and I kind of realized, this is all about metrics, and patient care is secondary to the profits and the metrics. And I started to look into what can I do to get out of this kind of fee for service model, or this kind of insurance based world that is dictating how I can take care of people. And at the same time, the regular system isn't set up to help with what really matters with health, which I think is prevention. Um, it's not just about treating, it's about preventing, it's about all the other things, not throwing medicines at people. It's about lifestyle modifications and all the things that we didn't really get trained to do as doctors. And so that's part of the reason why I got into lifestyle medicine. And then I realized, well, I can't really practice the way that I'm supposed to, which is giving patients time, frequent visits, kind of really digging deep into root cause in a 10 to 15-minute primary care visit, which is really what unfortunately is the current reality in this kind of healthcare system. And so I realized at some point that I had to break off and do my own thing. in order to take care of people the proper way. So that's the reason why 2 years ago I opened this practice in a leap of faith, and it's worked out so far. So thank God. Yeah, it's been a great experience, having patients like you and other people who, are invested in their health, I think has been really, really gratifying.
That's awesome. How do you differ from, and you sort of mentioned it, not only the time, because you can give
Mhm,
your patients time, but how do you differ in other areas? I mentioned that you talk about holistic treatment. You
mhm.
mentioned you don't just throw medicine at patients. Overall, how do you differ?
Yeah, so I think most people have been patients at some point in their life. So I think many people can resonate with the idea that when they see a doctor, a lot of times it's really just a very surface level visit. You come in with an issue. Many patients feel like that issue is being addressed. The root cause is not really being evaluated. um, and you're really not digging deep. A lot of patients who come to me will say, I always felt like medicines were being thrown at me, but nobody was ever really trying to get to the root cause. And what I always try to say is, doctors mean well and we want to help, but the way that the Western medicine training is, we're very good at kind of figuring out what's going on, and treating that to a certain degree, but we're really not so great about getting, again, to root cause and prevention, and then also just talking about wellness. A lot of people will say, okay, the doctor said I need to lose weight. They're like, just, eat less and move more. Um, but beyond that, they can't really dig deep and kind of give that type of specific advice on a granular level. And so I think that's part of the difference too. I would consider myself integrative. I'm not an alternative medicine doctor. So certainly, I do prescribe medication if people need something. But at the same time, I'm trying to get to, like, what is the reason behind this, and how can we get you as the patient to have control and empowerment of your own health, to where we can really improve whatever this chronic disease is, um, and optimize it as much as possible through lifestyle modifications. Because, a lot of people, 80% of chronic disease is potentially reversible, or at least managed through lifestyle modifications. Not everything, so don't get me wrong, but to a degree, I think that the traditional system kind of takes the power away from patients, because now you feel like, oh, I have to go to the doctor to get these medicines or get these treatments, and I don't have any control over my own health. And so part of what I do is try to put that power back in the hands of my patient, and working together as in a collaborative model to kind of really help optimize health, and looking at that whole person approach. How's your sleep?
Mhm.
How's your nutrition? Like, how much movement are you getting? What's your stress level? So that's what lifestyle medicine is. It's really kind of looking at all those lifestyle factors and really being able to dig deep to provide therapeutic lifestyle solutions that are evidence-based, that can help, optimize health in that way.
Mm. Once again, I'm gonna just say it again. She's my doctor, not yours. But but I also remember, like, it's so true, because I remember you asking me about my relationship to food, and I'm thinking, like, why are you asking me that? And then, not finding out, I knew I was an emotional eater, and you're like, well, what do you eat? And I'm like, girl, Chick-fil-A. And you're like, well, Nia, why don't you try the grilled chicken and the salad? And it was like a light bulb that went off in my head. Like, it was almost like I didn't know they had anything else other than what, the 8 count, whatever.
That's interesting. I didn't. I didn't know that was going on in your head.
But you are very, like you said, lifestyle based. Like it's not like, okay, Nia, you need to eat air and drink kale smoothies.
Mhm.
And I could get to that, but you understood that it's a process.
Yeah, exactly. You have to meet people where they are and then help get to where we want to be, because what I realize is it's not easy, right? Living, the tenets of healthy living are not hard, or I should say it's simple, but it's not easy. You know what I mean? The lifestyle that we lead, and I include myself in this because I certainly am not like perfect. The lifestyles that we lead, it's so easy to just not eat right. It's easy to be sedentary. It's easy to be under chronic stress. I mean, there's so many things going against us. Like it's almost a full-time job to try to live right. And sometimes it gets overwhelming because you know what needs to be done, but not always kind of how to get there. And sometimes you don't know what needs to be done because there's so much misinformation, mixed messages, all these like wellness and health, influencers out there. You don't know who to trust. You don't know what sources are legit. And then there's, all these marketing things against you. Because, for example, you're talking about Chick-fil-A. There's so many people that believe Chick-fil-A is like a healthy fast food place compared to, say, McDonald's. And that's debatable, right? Because then if we actually deep dive into the nutrition of like some of the things that we're eating, there's this halo of health around Chick-fil-A or other places, and it comes down to really savvy marketing a lot of the time. And so what I really try to get into with people is like, what are the basics of healthy eating? It's not that complicated, and how can we simplify this process and kind of like get us to that point. You know what I mean? And it's for everybody, that's a different path. You can't generalize the approach, and it's always going to be a work in progress. Nobody is going to have the solution and just in game over. Like it's all about progress in life, but that's why I love the progress is what I love to see, because you look back and you're like, oh my gosh, compared to a year ago, I'm feeling so much better, and I'm healthier, and my whole job is just to help, patients get on that path, and in doing so help myself, because I always say, I tell everybody I have a major sweet tooth. I'm not as physically active as, I could be. So please don't believe that I'm sitting and looking down and, oh, this is what you need to do, because this is all of us all the time.
I love that. I feel like you created the phenomena of we listen and we don't judge.
I love that. I love that one. Yes.
Because you
Bye.
do, and you're like, okay, and like so kind about it, but let's try this. You know?
I can judge because A, again, I'm not perfect, and B, what's the point of being judgmental? Like I understand how easy it is. And unfortunately, if you look at the statistics, it's just getting worse, right? It's not that people have gotten lazier or dumber over time, right? Like with the rates of obesity, with the rates of chronic disease, something is changing, and it's not our intelligence or our level of motivation. There are so many external factors that are working against us. That again, like it's really a full-time job to live right. So I can't, who am I to judge?
I mean, and specifically now that makes me want to know why did you specifically get into obesity and lifestyle medicine? I mean, you could have been an OB or this or that. Why specifically is this like, you know what, I need to be the I need to practice this.
So so first of all, I'm an internal medicine doctor. So what that means is I see adults. So compared to, say, family medicine, they see like cradle to grave, but I specialize in adults, and I am a primary care internal medicine doctor. And so my first job out of residency, I took care of people that were in this demographic where they were older. They tend to be, 65 and up. There were lots of chronic disease, lots of socioeconomic challenges. And I just really started to realize that there's so many things that's happened to these people that was like totally preventable.
Mm.
And many people, for example, I have so many people with diabetes, and they would say nobody has ever actually explained to me what diabetes is, or like how I should be eating healthy. Like, okay, yes, low carb, but like what exactly is a carb? So
Yeah.
I really, and it would blow my mind that people have been on diabetic medication, insulin, and all these things for decades, and nobody's ever had that conversation with them, right? And so that's when I started to realize there were so many things, things that I would think were common knowledge, but it really wasn't. And so the first thing that I did, I went to like this nutrition conference. It was like an integrative medicine nutrition conference. And that is kind of where it started for me, because I was like, oh my God, people need to know this. I even had a website at one point where I just felt like, okay, here's some information I can disseminate. And then when Instagram started being a thing, at one point I was like, okay, instead of having this website, I could do it on Instagram.
Mhm.
And people, respond well to that. Even sometimes the simplest posts resonate really well. But I realized that I didn't have the tools. Training, I went to school for 11 years, and I came out and I was like, I can't even have a proper conversation with a patient about how to eat healthy, because we didn't get trained in nutrition really in med school. We didn't really get trained in all this stuff. So that's when I decided to do lifestyle medicine, because that's really what it is. And so I got board certified in that in, I think, 2018. And then when it comes to obesity, obesity is a chronic disease. Obesity is a chronic disease that causes a ton of other chronic diseases. And if you don't help people treat their excess body weight, like how are you going to help them with their blood pressure, their high cholesterol, their diabetes, all these different things, their sleep apnea, all kinds of stuff. So then I started to realize, you know what? Sometimes lifestyle medicine is helpful, and sometimes, there's other tools in the toolbox. So some people also need pharmacologic assistance with medical weight loss, and they need that guidance that is just not, going online and signing up for some medication and not really having all the other tools and skills and get into the root cause of obesity. And so then I was like, well, I guess I should do obesity medicine certification so I can feel competent.
Yeah.
And so I did that a couple, 2, 3 years ago.
Mhm.
And that just kind of, as I practice and I see what the needs of people are, it kind of guides me into where my knowledge deficits are, and then what I need to get more competent in. So, for example, right now I'm kind of starting to realize, like, female hormones, when we start getting into, so at a certain age, and it comes to weight loss, and it comes to all these perimenopause, menopause symptoms, that's another area that's been really neglected, and that kind of ties into all the other things.
Right.
And so now I'm kind of like getting into that. So it's like, as I see the needs of the people, that's when I kind of realize, like, okay, I need to I'm maybe not going to get certified. I don't feel like I need to keep getting, certificates and that kind of stuff, but it's more just continuing medical education. Like, we all do it, all doctors really need to continue to learn and grow. And it's really been surprising but disheartening to me too, to also see that there's so many primary care doctors, especially, who still are not comfortable managing obesity,
Mm.
which is crazy, because it's like 7 out of 10 adults have overweight or obesity. And again, it's the root cause of a lot of other problems. So if you're not comfortable helping patients manage that, then we're really not, you're scratching the surface anytime you're trying to treat anything. So part of what I want to do is just like spread that knowledge and just kind of help people again be empowered into how can we prevent this, how can we treat this naturally as much as possible, and if I do need guidance from a pharmacologic standpoint, like what's out there, what's safe, what's effective, that's kind of what I've been getting into a lot lately.
You are ever learning, ever evolving, and it's like
Wow.
you're happy about it. Like I feel the energy.
I mean, I think that yeah, this is, I love to learn. I love to know how to help people. And then it's gratifying when you see the results, right? So it's really nice, and it's not like I'm doing anything, it's not that difficult, right? At the end of the day, like a lot of these things are so basic and so simple, and it always surprises me what makes people so happy that, just simple little things like being able to communicate, being able to have longer visits, being able to just sit down and talk about, tell me what you eat, tell me about your relationship with food, those kind of things. I'll have patients that say, nobody has ever asked me these questions before, and it's just, I feel like this is the way that I practice is the way that I think that it should be. But unfortunately, the system isn't set up to support that. So hopefully on a macro level, over time, we can really realize that this is the way that you keep the population healthy is through this type of model, these type of conversations, this type of, holistic approach, because the system is we're at a point where people are just getting sicker and sicker. Healthcare is getting way more and more expensive. It's getting deadlier. Doctors are getting more and more burned out. Like it's up in flames right now. It's really up in flames. And I have a lot of doctors on a regular basis that will reach out to me and say, like, how did you get this practice started? Because this is what I have in my head. This is what I want to do. I just want to figure out how to do this. And what I'm doing is not unique. I didn't create this model. I've also picked a lot of brains over the years before I even opened this practice. So I don't want to, act as if like I design this thing from scratch, but every practice is unique. So I have colleagues who do similar things, and everybody has their own approach and their own kind of unique way. So you talk to me in 5 years, I might be operating differently than I am today. And it's growth is key. You either grow or you die, I guess.
Yeah. And you're proof that establishing a patient provider relationship is essential. There's times I've been in your office and you're like, what's wrong? And I'm like, how does she know what's wrong? Like,
Yep.
and you're like, let's check your lupus levels. And I'm like, what? And then the results come back and it's all over the place. Nia, talk to your rheumatologist. And, Nia, talk to your rheumatologist. It's like,
Yeah.
because we have that patient provider relationship, you
Mhm.
you go above and beyond or what you're supposed to do, and you follow up. It's just like,
I think the doctor-patient relationship is such a unique thing because when it comes to health, I think people are at their most vulnerable sometimes. And, I have seen the bad results of so many patients who have a mistrust of the healthcare system or had like a negative experience with their doctor. And because of that, avoided getting care. I have so many people who something bad happened, they just say, okay, I feel fine. Years later, they come in with just florid chronic disease, uncontrolled diabetes that they didn't know they had, high blood pressure, and all these different things. So I think that that relationship really is important and is very sacred. And doctors, priests, and lawyers, I think you hear things about your patients or your clients that they will never tell another soul. And so I know, I know you, I know a lot of my patients better than a lot of people do. And again, it's because of this model. Like if I were a typical primary care doctor who unfortunately, typical PCP has 2 to 3,000 patients on their panel. How am I going to remember to follow up with you and say, hey, did you see your rheumatologist? If I have 3,000 other people to worry about, this is impossible, right? And so, with my practice, I have a smaller number of patients that I take care of a lot better. And, I could sit around feeling guilty that I am not in this traditional model and I'm taking care of less people, but it's either this or it's nothing because I can't practice medicine halfway. And again, I have so many colleagues. One of my friends from my school who's primary care, like literally just up and quit because they were like, I can't practice this way. And they're trying to figure out what they want to do. And I see that happen all the time. So for me, I think that if all of us kind of followed our passion, had our practices that maybe you have a smaller number of patients, but you're taking care of better, overall, patients would be getting better quality care. I can't sacrifice myself or martyr myself by operating in a system um, that isn't serving my patients well and it's not serving me well. So, you know,
You are
yeah.
deep. What has been like I want to know the feedback that you received from your patients. Like, is there any particular one or two that they've
Mhm.
said thank you so much, or the change that you have implemented in their life? Can you share that with us?
I see it all the time. So first of all, the patients that find me, it's a little bit of selective, a self-selective thing because I think the people that are attracted to this practice model are people that are invested in their health. So with my practice, we do meet and greets before patients even enroll and people see, oh, I'm into lifestyle medicine and all that stuff too. So a lot of times it's people who really either the system has already failed them and they're looking for something different, or they realize that now is the time to invest in my health. So they're already coming in with that approach. But I've had people, my first visit is usually at least 60 to 90 minutes long. And I've had patients cry like at the end of the first visit because they're like, oh my God, I didn't even do anything except just sit and listen. The bar is so low. That's what I'm saying. The bar is so, I am not doing anything that is way out there. I'm just sitting and listening to people and empathizing with people. And that is shocking to patients on their first visit, which is sad that the system is so terrible, right? And then of course, you have people who come in and they feel so defeated because they have all these labs that are off and all these other stuff and they don't know how to get started and they feel like they haven't been taken seriously or they haven't gotten help. And then once we kind of get them to where they want to be, I mean, I regularly have patients who just are expressing gratitude for this type of practice or saying things like, this is the way medicine is supposed to be. And it just keeps me motivated to keep doing what I'm doing when I get that feedback because I know I have to be doing something right. um but there is that sense of guilt sometimes too. I can't take care of everybody, which is part of the reason why I have the social media presence, because I feel like, okay, I can't have 3,000 patients because the math wouldn't math that how many hours in the day that I would need to take care of all these people. I can't do it by myself, but surely there are ways, to disseminate the knowledge so people can kind of benefit from it. And, part of what I want to do more of it, more community outreach, more kind of group things where people can feel like they're getting something out of it, even if we don't have that one-on-one relationship.
Yeah. And I kind of beg to differ because what you teach me and your other patients, we are then able to teach other people. Like, and so of course I'm not a doctor and I can't say, oh, you need metoprolol, whatever. But like I'm able
Mhm.
to say, like, well, so what is your relationship with food to my friend?
Right.
You know what I mean? So like you
That's
are
a good point.
touching other people, although like you said, it's not one-on-one, you're spreading the information, which a lot of us don't
Good
have.
point. Thank you for that. Yeah, I think that's a really good way to think of it to make me feel better.
No,
But I mean, and
seriously.
and I will say, certainly I see it on a micro level because I have people who, they're in their families. So maybe they're the moms or their parent, and some of the lifestyle kind of habits then they can spread to their people, and then that creates a whole feedback loop. So I think that is really that's a nice way to think of it. So I'll hold on to that one.
I wonder one of the reasons why you are so like you're not one of 100, you're like one of one. I wonder if why that is your upbringing and where you come from. Do you think that plays a part, if any?
I'm sure it does. So for example, from my holistic approach, I think is definitely related to growing up in the Caribbean. So if you're from the Caribbean, in general, you respect the concept of food as medicine.
Mhm.
That concept seems to sometimes be surprising in America, but I think you know, we always grow up knowing like what you put in your body matters. Like oh, you're sick, you go pick some aloes from outside, you drink some bush tea, you feel sick, you go swim in the sea, like we always kind of had that whole approach to the earth is nourishing. And my mom specifically, she actually it took me a long time to realize the impact that my mom's health in when she was younger had on me.
Mm.
When she was in her, I don't know, 20s or something, she had just some s- undiagnosed, to this day we don't know what it was, but she had a lot of systemic problems, a lot of like chronic pain, a lot of GI issues, and it took traditional doctors couldn't figure it out, and it took a naturopathic doctor to really help her heal. And it was things like, cut out these type of foods, stop cooking from this type of material pan. You have
Mhm.
to be mindful about what you're putting in your body. I mean, I don't know if you saw that a few days ago, they just said, oh, the FDA is banning this red number 3
Yeah.
food coloring. And it's one of those food colorings that was already banned from cosmetics, but it took them another couple of decades to ban it from food, which is ridiculous. But then if you're one of those people who are talking about, oh, I don't want to eat certain things because of there's this and that in it, all these additives. Sometimes people look at you like, oh, you're just, you're crazy, you're looking too deep into things. But at the end of the day, there's so many things that we're exposed to that probably is literally killing us, right? And so my mom's experience made me respectful of the power of lifestyle. She had these books lying around like herbs, like healing herbs and that kind of stuff. So that was always something that I was into. And then when I did, traditional medicine, came to the US, I went to med school and stuff. Like none of that stuff was really emphasized. Everything was like, what does the evidence talk about? And we don't talk about herbal medicine so much. We talk about all the pharmacologic things. And again, I prescribe medications when they're needed, and I don't want anybody to leave with the impression that all medicine is poisoning us and you shouldn't be, because there's so many people who I'm like, you can not take that blood pressure medicine, but your blood pressure is at stroke level, and come on. But let's start the medicine, and then let's also figure out, why is your pressure high? Let's figure out how we can work on it, and maybe in the future you may not need this medicine, or we can de-escalate it. So I kind of operate from that just very integrative approach. It doesn't have to be either or. but I think so many of us kind of just feel like if you don't, you don't want traditional medicine, you just have to stay totally off on the alternative side. And I've seen the consequences of that too. So you just trying to find that balance, I think, is always that is a challenge.
You are the doctor's doctor. Jeez Louise, do you teach classes?
Hardly. No.
You need to.
And again, like I follow so many people, I listen to all these podcasts and do this. I mean, there are people that have figured this thing out a lot longer than I mean, everything that I'm saying, there are people who've been practicing this way for decades, and they were kind of maybe the frontier. So I think where I am right now, there are people who are with the vanguard, and then there's like early adopters. And I feel like maybe in medicine, I would be like an early adopter. But this is thankfully, I think, becoming more and more prevalent as people just realize like what we're doing is not working. We need something else. But it sometimes it's just hard because people are getting all these messages, and then there's this distrust of the system that's happening, especially in Black and brown populations. And so one of my special interests too really is getting people in our communities to invest in their health again. Because again, I see too many people that come in after they've had the stroke, after they've had the heart attack. And then you look back on it, and when is the last time you saw a doctor? And decades, never. We need to take care of ourselves. We need to invest in self-care. So my motto for 2025 is like aggressive self-care, because we need to get on that train. There's a lot of communities that are already into that, but I really want to push that for people of color. That's one of my mission statements for sure.
I love that. Because going to you, you allow all your patients, but in particular, as you mentioned, people of color, to be seen.
Yeah, I hope so. I hope that they feel that way. I
Yeah.
hope so. I mean, it's nice, and there are not a lot of Black doctors out there, just statistically. I think there's like 4% of physicians in the US are Black. Um, and there are a lot of Black folk who are looking for somebody who looks like them just for comfort level, or they had a bad experience, or and justifiably so, because there's studies that actually show that Black people get better medical care when they have a Black doctor. Um, so I have people of all shapes, sizes, colors, everything in my practice, but I definitely have a nice proportion of Black and brown patients and Black women. I mean, I just have such a soft spot for, well, I have a soft spot for Black women for sure, because I think that there's so much that we shoulder every single day. But I will tell you that like Black men have been so forgotten in like the system to like the healthcare. And in general, I think women are more invested in their health. This is stereotypical, but it's also true. Unfortunately, men tend to ignore things until something happens. That's not always true, but there's a reason why they say married men live longer than single men, because their wives drag them into the doctor, and that's kind of a socialization type thing. But I think that the statistics for Black men, I mean, when people come in with the undiagnosed, just hot mess type stuff, it a lot of times it's my younger to middle-aged Black men, and I just am like, no, we gotta get you on track. We gotta do better. We gotta do all these things. But I think that women, we face our own set of challenges too, because sometimes we feel like we're not heard, dismissed, symptoms are dismissed. It takes longer for stuff to get diagnosed because you kind of brush it off. So there's a lot of challenges, and like that's one of the things. It's funny, in med school we got taught a lot, like there are racial differences between, the chronic disease in terms of severity and the mortality. And it was kind of made to, the way we were taught, it was almost like it was due to like a genetic difference, but it's not. It's due to a lot of times systemic racism, the differences in access to the healthcare system. So it's more of a social difference than a genetic difference. Because I know you can talk about, like, for example, breast cancer, right? I'm sure you know, obviously, that Black women tend to get diagnosed later, more aggressive, late stage, for multiple reasons. And it's not just like, oh, they have this gene that makes that happen. It's not that. So, yeah, so there's so many little there's so many little torches that I'm carrying right now. Just based on the communities and the populations that I see, but that's one of my things, is like aggressive self-care, especially in the Black community, because I had last year it hit me. I was in a group with a bunch of other health professionals, like physical therapists, yoga, wellness instructors, and I was literally the only Black person in the room.
Wow. Okay.
And then I also kind of thought about, well, their clientele, how many of them, are Black or brown? Probably not that many, right? And so that's why I'm kind of really, and thankfully in the community, there are more kind of people in the wellness community of color, but I think that we have a lot of work to do. And I think that there's also this culture too, again, of not taking care of yourself, taking care of everybody else first. I did a podcast last year with a mom who, so she has a podcast. She's talking about, being a parent, and one of the things we talked about was how parents put themselves on the back burner health wise, and especially moms. And I see that all the time here, all the time here. And so many times I have to tell patients, like, you need to prioritize yourself. Like, you are cooking certain things because your husband doesn't like to eat veggies, or like whatever, your kid, just forget about them. Cook what you know you need to cook, and they can fall in or they can fall out. But like, you're gonna cook poorly and eat things that are not great, that you don't even enjoy because of other people. So like, let's get selfish a little bit with our health. That's kind of what I'm trying to promote this year.
I
Yeah.
love, oh my gosh.
Don't get me started, okay?
I mean, you said
I have
get
a lot of
in.
goals.
She said get in or get out.
Yes, I'm sick of it. I'm sick of seeing that. I'm sick of seeing it. And it's so common, It's so common.
You were definitely made for a time such as this.
I think more of us are needed, and we're rising up. And this is the time, because it's not getting any better. And I think we just have to really have a mindset shift as society on like what health means and kind of how to get there. And we just have to shout from our little rooftops, and then hopefully that affects change on a societal level, and then hopefully on a macro level, because a lot of this too, there's so many policy things that has to happen, but um everybody just has to do their part. Like, you have these podcasts, I mean, you're so busy. Just I don't even know how you have time with this, and then you just you're always doing something. You're always, I can't keep up with all the things that you're doing, the expos and the talks and all the awards and all this and that. But you're doing your part, and you have your niche, and you're getting the message out. And if all of us just have our passion and work within that, and collaborate together when we can, I think that's where the change happens. So thank you also for doing
Oh, girl, doctor, sorry.
this. Is no, you we're girls. We're sisters. This is
You
good.
need to be a keynote speaker at a lot of places. Because especially when
I would get they would have to run me off the stage at some point because I would just not stop talking.
but especially to teach back to the physicians, or the people going through a med school or residency to say, hey, like what you're learning, cool, but
Mhm.
I'm on the other side of it, and this is also what you need to learn.
Yeah, I think that is something that I really do feel passionate about that I want to do. And I think some of it is, I'm kind of 11 years out of residency. I think when you're like a baby doctor, you don't feel like you have the authority to tell anybody anything because you're still trying to learn. But I think after you've been out for a couple years, I mean, even though I know that I look young,
You are young.
I'm 40 years old, but
Yes, so
I've
young.
been in this for a little bit. So I feel like I have enough experience that it's worth sharing. And I've had so many people before me with experience share with me. So you just have to kind of just have to pay it forward.
What are your other goals for Restore MD beyond, 2025, 2026?
And I have a lot. So my 5 to 10 year plan is that, I know I'm the one person I can't clone myself, but I hope that at some point I can attract other like-minded doctors to, maybe join the practice, have their own panel of patients. I'm not sure of mine.
Period.
And just period, right? Have and kind of almost have like my dream is to have almost like a complex where this a one-stop shop building that you can go to, and you have, the doctor, and you have, like your physical therapist or your yoga instructor, and it's all kind of that holistic integrative approach where we're collaborating, and so patients can get everything all in one place. And I'm hoping that it wouldn't just be practicing, but also kind of, again, workshops, group things, more community outreach type programs, in the local community, and then beyond. That's kind of, I'm very intuitive in my approach. So you have these grand plans, but I go where the spirit leads, right? So where the need is, that's where I kind of have to follow. So I try to make loose plans, but my intuition tends to guide me to where I really need to be. So we'll see. We'll see.
So number one, it's going to happen and you're going to create the model for the world. But then number two, see, you keep leading me to other questions. How do you trust? First of all, how did you find your intuition and how do you trust that?
Oh my. Now we're getting real deep. I think that I've always been the type of person that, how can I say it? I think I've always been the type of person that just knows that no matter what, it's gonna be okay. So I think that I've never had a spirit of like fear. And a lot of that is how I was raised. I was raised to be confident, to know that I had worth, to know that I had value, and that I was gonna do big things with my life. So thanks, mom and dad. But throughout my life, I've had challenges. So like, I'm gonna tell you, I almost didn't get into medical school because, I was an international student. I didn't get the highest MCAT score. I only applied to 3 medical schools. And if anybody who's going to med school, they would just be shocked because people
Really?
apply like maybe dozens of med schools because it's so hard to get in. I was just at that point where I was like, listen, if it's gonna work, it's gonna work. If it doesn't, I'm gonna pivot and I'll figure it out. And thank God I got into into med school. But, I knew that I have faith, I am spiritual, and I just believe like whatever God's plan is God's plan. You can plan, you can have all these things in your mind, but I know it's not up to me at the end of the day. I just have to have myself prepared. And whatever opportunity then kind of comes my way, that's what it is. And that I've seen that throughout my career. I've seen it especially since I've opened this practice, because that was a huge leap of faith too. I mean, it took 5+ years for me to do it, don't get me wrong, but it took a long time for me to take that leap of faith. But then I see the results of that every day when there's so many things that have happened and so many opportunities that have presented themselves because I put myself out there, and things that I would have never, just volunteering to do things leads to another opportunity, which leads to another opportunity, which leads to an idea, and you meet the right people, so life is really about that combination of preparation and opportunity. So like when the door knocks, like, okay, I'm ready to open the door. But you just can't lead with a spirit of fear, because what's the worst that can happen? Because like I said, okay, with my practice, what's the worst that can happen? It's not successful, and then I have to go back to the regular system. But I'm not gonna die, right? But what's the best that could happen is what's happening now. So I'm always that advocate, and I had people again who did this before me who encouraged me to do this practice, and they said you don't have to be 100% prepared before you jump into something. A lot of us feel like we got to be 100% ready before we do this, but life is about learning as you go and growing as you go. And sometimes it's like, this might be not a good analogy, but like trying to fix a plane while it's flying. Like you figure it out as you go along, and you can do it. Like one of my colleagues told me, do it scared, but just do it. And that was one of the reasons why I opened this practice, for sure, because I was nervous and I wanted to have all my ducks in a row. And it was like, you're never going to have all your ducks in a row, never, but you'll figure it out as you go along. So if I had one bit of advice for anybody, would just be, if there's something tugging at you, something that you can't get your mind off of, something that you really want to do, you're going to look back with regret if you don't at least take it to see how far you can go with it. So just like try not to have that spirit of, it's okay to be scared, but not to the point where it's paralyzing and preventing you from fulfilling your purpose in some way.
That's great advice. It's like when people say choose your hard.
Yes, exactly. Because it's not going to be easy. There's going to be a challenge for sure, but this is the type of challenge that is worthwhile. I had people telling me who were trying to discourage me from opening this practice. Oh, you have small kids. Is that the best idea? You're going to be a business owner and a doctor and a mom. Like, aren't you going to feel overwhelmed? And, so those people, I say, what was that? Um, but I had way more people encouraging me. And even if I didn't, because there were points too where, if I listened to every single person, I would have just been again paralyzed in indecision. So at some point you just got to be like, the decision is up to me, and I just have to see it through, and that's it. So here we are.
And you said this, so you're a physician, you're a business owner, you're a mom, you're a wife, you're a daughter, you're a friend, you're a colleague. In all of those hats that you wear, who do you say that you are?
That's a great question. And you know what? I have never defined myself by being a physician, or by being like, how some people like they introduce themselves as a doctor or a wife or a mother or whatever. I'm like, I'm me. I'm me. And I have a lot of roles, but at the end of the day, I'm Kim. And I don't define myself singularly by any one of those things, because if I couldn't practice medicine today, that wouldn't kill me. I would have to pivot and do something else. You know, of course, being a mom is the most important role, but if I was not a mother, or if I was childless by choice or whatever, I would still be me, you know? So I don't like to define myself by like who I am to other people.
I
I'm
love that.
I'm just me, you know?
How did you learn that? Your parents did a good job.
Again, thanks mom and dad, because I was raised by strong people. I was raised by a strong woman. You know, my mom was, you know, both of my parents actually own their own businesses, and just were independent people, and they just always fostered that spirit of independence. And you know, just they always they never made me think that there was anything that I couldn't do. So that's part of the reason why I am the way I am.
You are amazing. And I don't want to ask this last, or yeah, I don't want to ask this last question because I'm being selfish, but I'm going to ask it. Where can people find you?
Well, physically, I'm located in North Wilmington, Delaware. So my website for my practice is RestoreMDmed.com. But if you're not nearby, I'm available on social media. So I have my, you know, Dr. Kim Lifestyle MD handle on Instagram, or the Restore MD Med one on Instagram. And I will say, like, I'm not as consistent as I should be on social media. You know, I go through these phases where I'm like active and then I fall off for a while. And that's, you know, one of the things I want to say too is, with all the hats that I wear, you can't wear them all at once. So like, anybody that makes you think that you have to be juggling all the balls all at the same time are just lying to you. And one of the things I will also say is, I am very quick to be like, I don't have the bandwidth, I'm not doing it. So I don't pride myself necessarily on like, I can juggle all these balls at once, even if I get burnt out. I connect with myself very strongly, and I can tell when I'm doing too much. And I am quick to cut something off. I'm quick to say the social media is taking a back burner, or, you know, developing the business has to take a pause because I'm tired and I need a break. And it's okay, because that's part of the aggressive self-care that I was talking about. And so maybe if I was that hustler mentality, I might have been bigger than I am now, but I don't need that, because at the end of the day, it still has to feed me, and it has to give me joy. And if it's not giving me joy, then I'm just gonna have to figure out why not, and I have to cut it out. So if you go to social media, you don't see me post for a few weeks, it's just because I have other things that I have to do, like rest. But I do try to, you know, stay fairly consistent with kind of just disseminating that lifestyle medicine kind of knowledge, and just kind of ways to stay healthy, to self-care, and just evidence-based lifestyle stuff, and a little bit, you know, sometimes a little bit cheeky, sometimes a little bit funny, but I just try to keep it real, because I think sometimes people just need to hear it real.
Y'all can't have her. I mean, and this is why I think you're so amazing, because you show up for yourself so that you are able to show up for others.
That's it. You cannot pour from an empty cup. Can't.
Yeah, y'all can't have her. I mean, you heard her, Restore MD, you know, Dr. Kimberly Rogers, but y'all can't have her.
Don't worry, nobody will ever take me away from you.
But I mean, I know, like, when they see this and hear this, they're like, oh, yeah, like, so I'll just say this, not to be selfish, take my selfish hat off. If you're in the area, y'all better hit her up. I mean, obviously, follow her on social media, get all the information that you need for your life. But if you're in the area, I mean, it's going to be a game changer
Thank
in
you.
your life. That's all. And then now I'm going to put it back on. So
I appreciate you.
I appreciate you too. Thank you so much for sharing your wisdom, your life, your impactful ways with us. We really appreciate it.
Thank you for having me. Anytime.
You heard it from Dr. Kimberly Rogers, RestoreMD. We'll see you soon. Bye-bye.
Thank you for joining us on the Humanitarian Heartbeat Podcast. Remember, each conversation brings us closer to a world where compassion thrives. Stay connected, stay informed, and let's keep the heartbeat of humanity alive. Subscribe, share, and be a part of our journey to make a difference, one conversation at a time. Until next time, keep your hearts open, your minds curious, be a blessing to others, and give agape love. God bless.